Danny Fassbender, and as you can tell, I'm not in the studio today. At channel N250, we're providing you a special on tuberculosis. That's why I'm here in Lima, Peru. Now, it may be known that tuberculosis is an issue in Peru. But what most Americans fail to realize is that it is also an issue in their own country, the United States. Tuberculosis is both prevalent in the United States and Peru. It is a disease that affects typically the lungs but can affect other organs as well, and is an airborne disease that is passed on through coughing, sneezing, singing, and speaking. I'm here in Peru today so that we can compare tuberculosis between this country and the United States. We are going to be looking at the history of tuberculosis and then comparing tuberculosis in Peru and the United States from socio-cultural, economic, and geographic standpoints. Here's Brandy in the studio with the history of tuberculosis.
By a German physician, Robert Koch. In 1890, Koch claimed that he found a cure for tuberculosis with killed bacteria that he called tuberculin. But he falsely concluded that he discovered the cure. However, his discovery formed a basis for a skin test of the disease that is used in today's diagnosis. The true cure was found in 1943 by a biochemistry professor named Salman Waxman. Before 1882, doctors did not have a clear understanding of the real factors with tuberculosis, which include hereditary, social, moral behavior deviations, as well as a host of environmental factors such as poor hygiene, stress, overcrowding, and poverty. In the mid-1880s and 90s, New York City was under a crisis with two different types of tuberculosis. Prior to the crisis, the TB rate had fallen tremendously and then kept a steady rate throughout the years. For many years, the United States continued to battle tuberculosis, trying to find more ways to eliminate it. The United States developed organizations to help fund to eliminate TB, such as the World Health Organization and the Centers of Disease Control and Prevention. Then, in 1993, the rates began to decrease over time, reaching an all-time low. The reduction was caused by a comprehensive strengthening of control activities. Another country that had battled tuberculosis is Peru. Through the 1980s, Peru was one of the top 20 countries with the highest TB issue in the world. Tuberculosis was one of the leading causes of death in Peru in 1998. In the 1930s, the first group of physicians took an interest with the concentration on TB in Peru. In 1940, the government established the National Anti-Tuberculosis Service. In 1992, the rate increased extremely high, then began to steadily decline, not until 2011. Because of poverty and economical issues, Peru faced the horrible disease for many years. Even though Peru's epidemic was brought under control, the country still had more cases of disease compared to its neighboring countries.
Thanks, Brandy, for the history of tuberculosis. Now, as you can tell, I've moved locations so the viewers at home can get a glimpse of what traffic looks like here in Lima, Peru. By the looks of it, it's a little overcrowded. In the United States and Peru, one thing that these two places have in common when it comes to tuberculosis is that it's found in major cities, such as New York City and Lima. Since the cities are both very populated due to job opportunity, traffic is a major issue when getting to and from work. This is why most people rely on public transportation. As stated in a study done in Lima, overcrowding, exposure to a person with productive coughs while commuting 2 times a day, 5 days a week, and closed windows on minibuses, combined with high prevalence of pulmonary tuberculosis in Lima, increases the risk of acquiring this disease. When people are riding in packed modes of transportations for many miles, someone who has tuberculosis is bound to sneeze, cough, or talk. As stated before, tuberculosis is an airborne disease, and that's exactly how this is spread. Since it is airborne, it is more easily and quickly spread in places where many people are breathing the same air, such as public transportation. Imagine using public transportation to get to and from work just so you could support your family. But in the long run, you're actually risking supporting your family because you don't know what the people around you have. And if they do have tuberculosis, and they do happen to sneeze or cough or say hello to you, you could contract the disease as well. What a scary thought, just for using public transportation.
Thanks, Danny. Since some areas of the world are much wealthier than others, groups of individuals have the advantages of receiving proper health care where others may not. When the United States had an issue with a huge tuberculosis outbreak, they took immediate attention to it by creating a government group within the Center of Disease Control with a separate division solely on the issue of tuberculosis. Here are a few facts that were recorded from the United States recently. In 2014, 9,421 TB cases were reported. 1% of the United States population experiences homelessness in a given year, while 5% of the people recorded with tuberculosis were homeless prior to the diagnosis. Clustered in the 4 states today with rates of tuberculosis still being quite high are California, Texas, New York, and Florida. In New York, 77,430 people are still homeless, which is enough to fill the Madison Square Garden a little over 4 times. In comparison from the United States to Peru, here are some facts. In 2014, they had the highest number of TB cases in all of the Americas. While the general population of Peru is 39.8 million people, 1/3 of them live in poverty. To give you a comparison of the two, here's Peru right here, this small little pink spot. This is only about the size of the east coast of the United States right here.
Thank you for that great comparison, Raquel. In 2002, on average, the United States spent $644 a day on hospitalization for those with tuberculosis and $7,545 for an average tuberculosis patient's hospital duration. Peru did not have any information in regards to tuberculosis patients' hospitalization. However, in 2014, the World Health Organization recorded financing of tuberculosis control of national budget as Peru receiving $181 million and the United States receiving $135 million. Although Peru had received more money to help Peruvians prevent and treat tuberculosis last year, Peru had 14,000 more deaths than the United States. This is possible due to the living conditions being worse than that of the United States.
Thanks, Jess, for that awesome explanation of the economic background. As all 4 of us wanting to be healthcare providers, here are 3 ways that we can impact others to make a change. 1, we would all make sure that everyone receives the vaccine of tuberculosis to prevent from ever contracting the disease. 2, we would also get involved in the project of End TB to find shorter, less toxic, and more effective treatments. And the 3rd one, we would like to educate and spread awareness of the disease and how to prevent it.
Thanks, Raquel, for providing us with that information on what we can do as healthcare providers to help diminish the problem of tuberculosis in the United States and Peru. That concludes our special on tuberculosis. From Channel N250, I'm Danny Fassbender, live in Peru, signing off. Have a great day.